Hello and welcome to the webinar with Dr. Klaus Bruecker from Rejuv Lab London. I see the participants are building up. I give it a little bit more time. So I'm just being sort of quiet for a few more minutes before we start. More people are joining in. That's great. Welcome. We're discussing today how to overcome aging and lose skin. Obviously, something that kind of interests us all. And unfortunately, this is part of the natural process of aging. Still waiting for a few more people to join. Hello and welcome. Just giving it another 2 to 3 minutes. Hello and welcome to our webinar. Right, I think we are going to make a start. So hello again, welcome to the webinar, How to Overcome Aging and Lose Skin. Well, a presentation. So I started to work for Rejuv Lab. Rejuv Lab is one of the first addresses in Harley Street for general aesthetics. They have quite a very good team of aesthetic doctors and practitioners working there, doing multiple treatments which help to make you look the best. My name is Dr. Klaus Bruecker. I'm a general practitioner with extensive experience working in the private cosmetic sector and a very strong interest in aesthetic medicine. So just to talk in general about what is aging. Skin aging is characterized by features such as wrinkling, which we all obviously hate, loss of elasticity, again, something which we are suffering with, laxity, and a rough textured appearance. This aging process is accompanied with phenotypic changes in cutaneous cells, as well as structural and functional changes in extracellular matrix. So the causes, we all are aware of the causes. Obviously, one of the main causes is the natural process of aging. This is sort of exacerbated by sunshine, sunlight, smoking, also to a certain extent by dietary factors. So it is important to understand what the different types of aging are. So we age on a cellular level. Cells that can only renew themselves several times, and then their genetic material is no longer able to copy the cell accurately, which basically results in a damaged cell and free radicals, and further cells need to be produced then at that stage. Hormonal aging, we know all about testosterone. Testosterone levels reduce when you get older. Obviously, when you get younger, in puberty, it can cause you a problem because the testosterone levels are increasing. And therefore, sometimes you can have acne or larger pores. Estrogen levels are also decreasing when you are aging. So a hormonal profile sometimes can just determine what age you are. Then basically external accumulative damage, exposure to toxins. So we know the sun is quite harmful. There are harmful foods. There's pollution and smoke, especially when you live in a big city such as London. So these kind of external factors can lead to tissue damage, the body can kind of fall behind in order to repair this kind of damage. And as you get older, your capacity to repair cells or damage reduces as well. And then we have metabolic aging. We are constantly kind of turning food into energy, which produces byproducts that can be harmful. This just young skin looks like, and then we have as a contrast the old skin. So young skin, everything looks tight, perfect in order, perfect in line. And then when you have older skin, so this is a demonstration of a wrinkle, what it looks like. So it looks lax, saggy, and you know, the collagen is reducing. So what we're talking particularly today about is Thermage. Thermage has been around for many years, more than 9 years. Over 2 million treatments have been applied. The results are fantastic. It can be used for all skin types as opposed to laser or other treatments. And it's sort of practiced overall worldwide. If you ask me as an aesthetic practitioner, what is my favorite treatment, I would definitely say Thermage, because it's natural, it doesn't have any downtime, it doesn't really hurt, and it has overall good results.
As you age, the collagen in your skin breaks down, resulting in wrinkles and sagging skin. With just one treatment, Thermage uses unique deep heating technology that has been clinically proven to help renew your natural collagen. It is a safer, less expensive alternative to invasive cosmetic procedures and produces natural-looking results. This non-surgical procedure is fast and easy and requires little to no downtime. The result is smoother, tighter, more contoured skin that improves over time with effects that are long-lasting. The skin is made up of 3 layers: the visible outer layer called the epidermis, a layer called the dermis, and a deep subcutaneous or fat layer. The main structural component of the dermis is a protein called collagen, which is the key to healthier, younger-looking skin. These collagen strands are also present in the subcutaneous layer with the touch of the state-of-the-art Thermage treatment tip. Radio frequency energy is delivered to the deep layers of your skin, causing the collagen to heat, while the outer skin layer is protected by cooling. This deep heating produces 3-dimensional tightening with an immediate contraction of the existing collagen, followed by the formation of new collagen. Each time an energy pulse is delivered, you will experience the vibration along with a brief heat sensation. This indicates that the Thermage treatment is working to help tighten and stimulate your existing collagen. To protect your skin and make the treatment even more comfortable, the top of the skin is cooled during each application of the energy. Treatment with Thermage should be comfortable and requires no anesthesia or sedation. Your doctor may offer light medications prior to treatment. Patients can immediately resume normal activities. Good skincare and sunscreens are recommended as part of your regular skincare regimen.
Again, following the video, just to summarize, the beauty about Thermage is basically it's no surgery, no painful injections. It's just a single treatment. It's fast, it's comfortable, it lasts for about 45 minutes. If we talk about the face, 45 minutes up to 60 minutes. There's little to no downtime, so afterwards, after the treatment, there might be a slight redness of the face, there might be a slight fullness of the face, which is actually desired, and instantly there might be a slight lift of the facial features. The results improve over time. So when you have the treatment, initially there is some tightening, which you can see. Sometimes what I prefer to do, I just do one side of the face, then you can actually see the difference. And then we do the other side of the face. And then, because sometimes you don't, the changes are subtle that they're not very obvious to you. But if you do the one side of the face first, you will definitely see that there will be some tightening immediately. and then the results improve over time. So the maximum results you will see after about 3 months up to 6 months. Yeah. You can treat multiple areas. We can do the full face, we can do the eyes, we can do the nasolabial folds. These are all kind of different price points as well. We can do the sort of wrinkles around the mouth area. So it's applicable to all areas of the face and obviously several areas of the body. The beauty of Thermage as well, it's applicable to all skin types. With laser, you have sometimes complication with darker skin. So Thermage is for all skin types. Easy to use, easy to apply, with very good results. This is how it works. I think we've seen that in the video and it was very good explained there. So in principle is kind of radio frequency which heats up the deeper layer or all layers of the skin, so that it has immediately a tightening effect, and then later on as the collagen, the new collagen builds up, the skin pushes out, which gives you that sort of plumber, more youthful, natural look. So radio frequency is kind of an electric energy. So you have monopolar electrodes. So we can change the heads of the machine. So there are different heads for different areas of the face, different penetration depth, and you can see the monopolar electrode is for the deeper layers of the skin, whereas the bipolar electrodes is more for the epidermis, the outer layer of the skin. So if you have like acne scarring and things like this, you would use the bipolar electrode over these areas. This is just sort of a little bit technical. I don't think you would be interested in that. So the effect of the Thermage or the radio frequency in principle is collagen remodeling. So we can see the initial sort of the collagen, how it looks like is like a triple helix molecule, yeah. And then we apply the heat, it denatures the collagen fibers, and you can see that they sort of shrink in a way, and that gives the immediate tightening effect. But in principle, we kind of destroy some of the collagen to build up new collagen, if that makes sense. So this denatured collagen gives a sort of message to the body to produce new collagen, and that's the sort of end results. That's what we want to achieve, and that's what takes a long time. It's like growing kind of hair or nails. So the collagen needs some time to build up, and once the collagen has built up, it will stay there. So that's therefore you have these long-lasting effects. These are just simple things. You know, when you come to the clinic, obviously you will have to fill in a consent form. We explain the treatment in detail to you. We explain the risks, the side effects, before, after care. You have to remove your jewelry, you have to remove your makeup, but you know, ideally you come without any makeup on, but I understand that it might be a problem or challenge for some people. And you can do that in our clinic, and we have very luxurious facilities for you to kind of remove the makeup, and if you want to apply makeup after the treatment, which is possible. So the treatment experience, firstly, you are obviously sort of treated in quite luxurious boutique style hotel surroundings. It's a very nice environment to work in for me, and I guess for you as well whilst you're having the treatment. You feel like a warm, deep heat sensation which dissipates quite quickly. I actually had sort of people falling asleep because they found it really relaxing, and it can be quite relaxing. What important is that we obviously use, or we like to use, the maximum energy. The energy kind of changes depending on which area you treat. For example, you are far more heat sensitive here over the jaw area, over bone, whereas here where you have a bit of fat tissue, you can tolerate a lot more heat. we constantly ask you for feedback once we apply the machine, whether you can tolerate the heat, because the feedback is really important. We don't want to cause any burns. We don't want to cause any overheating. Overheating can cause redness, and overheating can cause some kind of swelling of the area. So we try to avoid that. And it's important constantly that you give us feedback whether you can tolerate the heat or not. Yeah, and if you have a little bit of discomfort, then we reduce the energy levels. Yeah. We can use vibration aids, so that's a little tool which vibrates, which kind of distracts you from the heat, which can be useful in some patients. Some patients have quite a lot of anxiety, but I actually kind of prefer not to treat them or prefer not to give any medication. I rather do a very good consultation and try to calm them down, or maybe they want to speak to other patients, or maybe they want to see me doing a treatment to relax them. But somebody with an anxiety disorder or serious anxiety issues, I don't think would be really suitable for the treatment. So the results, as we said, is what we want to achieve is this collagen remodeling, which kind of improves all kind of skin areas, tone and texture, whether it's over your knees, whether it's the tummy area, maybe you had a tummy tuck or you have some loose skin there, some loose kind of connective tissue. We can address that with Thermage as well. We can improve all areas of the face. So basically the aging collagen you need everywhere around your eyes, here the periorbital lines, the crow's feet, nasolabial folds, nasolabial lines. So all of this kind of can be tightened up and improved. Yeah, and like I said, is redness or swelling that like improves. If the worst comes to worse, you could get a skin burn, but that would be because the energy would be too high, and you know, the feedback mechanism wouldn't really work, because we start from low energy and then we ask you how much you can tolerate. There's also a built-in sensor in the machine which would give me a sort of sound effect to basically say, well, this area is getting too hot. So then you move to the next area, let the area cool down before you come back to that specific area. So, and like I said before, the improvement or the full results you will see after about 6 months. The treatment goal is obviously visual improvements to the entire treatment area. So again, softening of the nasolabial folds and the mesolabial lines, narrowing of the jowls, accentuating or redefining the jawline, renewed contour, improvement of submental hair fullness, softening of all lines and wrinkles, reduced appearance of hooding on eyelids. So we have this like really nice small kind of probe where we can sort of treat the very kind of sensitive area of the eyelids, which not a lot of people, not a lot of treatments address or can address, but Thermage is also good for that. We can soften all the wrinkles in any other body area, and overall the skin will appear smoother and plumber. Here we've got some results. Let me just see, I've got some question here. 1 second, I'm going to answer that. Or I just read out the question. So somebody asked, how long does the treatment take? So the treatment takes between 45 minutes up to 1 hour, depending on the area. So I would basically say 45 minutes for a full face, up to 60 minutes. But if you have only your eyes treated, that can be done in half an hour, 40 minutes. So we've got here a lady, and it's immediately after the treatment. This is basically what I mentioned. You have a little bit of redness there, and but you can see already this sort of tightening slightly of this nasolabial fold. She has more kind of fullness here over the cheek and eye area, and that line is slightly reduced as well, and that is immediately after the treatment. This is a lady sort of after 10 months. Again, quite a significant improvement, a subtle improvement. It obviously doesn't sort of give you the same effect like a full face surgery, but you can see quite a lot of difference. And I would basically say that she looks at least 5 to 8 years younger. So you can see around the eyes, the wrinkles have softened, they have smoothened. Here the skin under the eye is tighter. That's a really beautiful result. You can see here some of the wrinkles here, they have reduced. Beautiful jawline here, that's a significant improvement. And also the forehead looks a lot smoother. So overall, she looks sort of more positive, youthful, fresher. So that's quite a good result. And here we see in a male, the lower face, 3 months after, again, the jawline very nicely defined, a reduction here of the nasolabial folds, and overall, yeah, a sort of more kind of masculine jawline there. Here in terms of the knees, look at the skin, it's sort of all, well, what's the word for it, wrinkly, saggy, and a significant improvement here. Yeah, that's kind of shaves off 10, even 20 years of your legs only after 12 months, an area which is kind of difficult to treat usually. Another photo of the eyes. Again, you see that the wrinkles are not necessarily disappearing, but they are softer in appearance. So the only way to stop wrinkles from appearing in the first place, that's the Botox. But once you have the wrinkles in place, you can't really eradicate them, but you can sort of plumb up the skin underneath, push them out, and that gives it the sort of smoother, more useful the same here, beautiful results. Yeah, and then sort of the aftercare, there is just sort of basically resume your normal skincare regime. So I get a lot of questions about that. For me, the non plus ultra is vitamin C acid and retinol. That needs to be the standard stable in everyone's skincare regime. And then sunblock 50 definitely whenever you go out, and that's summer, winter, anytime. Don't forget to kind of cover your hands as well, because the hands sort of show signs of aging quite quickly. So yes, but you can sort of do anything normal after the treatment. You can wear makeup straight away, no problem at all. So obviously prevention is better than cure. So to avoid further damage or to avoid getting into that situation in the first place, you have to protect and shield yourself from the sun. It says here moisturize. I mean, I usually would say the word moisturize is no longer in the dictionary of a medical aesthetic practitioner. We talk about hydrating the skin. If you moisturize the skin, usually it's quite an oily moisturizer. All you do is you impact your dead skin cells on a daily basis. You're shedding skin cells, and if you just apply something which stays on the outer layer of the skin, it will just trap these dead skin cells, and there's sort of effect is, or there's actually zero effect doing that. So what you basically need to do is to hydrate the skin from within. So you need to use creams which travel inside the skin and stay there and attract moisture, attract water basically. So creams with hyaluronic acid would be quite useful to hydrate the skin. Don't smoke, obviously, and then eat a healthy diet. So the diet should be high in antioxidants, which prevent the sort of external toxins to have an effect like we discussed at the beginning. Right, I sort of have come to the end. I hope you kind of enjoyed listening to me. Further questions, where's the clinic? The clinic is in London, Harley Street. That's central London, London Harley Street. So if you have a look at the website, it's www.rejuvlab.com. Right, I'm just waiting for any further question. Is it good when you are 40? Yes, definitely. It's good at any age. It can be done. I mean, usually the clients are over 30 because you don't need to necessarily have a lot of skin tightening in your 30s. Yes, it depends what area you want to have treated. I think it's good at any age because you are just adding more collagen to the collagen you already have, which also sets you up for a better future in a way. More is more when we are talking about collagen. You can go back straight to work, yes. Sorry, I'm just answering some questions here. I'm reading them out. So somebody is saying, can I go back to work straight away? Yes, you can, no problem at all. And hardly anyone, when you go straight back to work, will see that you had something done. So you just look a little bit fresher. You look like maybe you had a facial in your lunchtime. Like I said, afterwards you can have, you know, already some tightening and maybe a little bit of redness. But you know, if you tell us you are going straight away after work, we can kind of focus on that and minimize that. Right, more questions coming in. Hang on, I can't see them. 1 second. Do I have to do anything after the treatment? No, you just have to follow your normal skincare regime. I'm not, you know, well, I like to advise on that, but you can do whatever you feel comfortable with. You can wear makeup straight away. You don't need to cool the skin. You don't need to rest. If you apply appropriate sunblock, you can go outside, no problem at all. So anything, yeah, anything you can do what you normally used to do. Do you recommend any skincare brands? I get this asked all the time. I don't necessarily like to answer that. Well, I would basically say Obagi, personally, if you ask me for my personal opinion. But there are so many around. It's so difficult to get to know them all, work with them all. Another brand which I can recommend is Interceuticals as well. If you simple things like retinol, if you want to have a stronger retinol, you have to basically speak to your doctor, you have to go to your GP, you have to have it prescribed. Obagi is also a medical licensed product, so you have to get that prescribed. I find simple things like normal skincare ranges from Boots can be quite okay as well. So there's some which I don't necessarily believe in, and I don't believe the hype. But you know, others they are kind of reliable. What days do you work? I just currently work on Saturdays for the clinic, but obviously, the clinic is open on a daily basis. Do we do lip fillers? Yes, we do. So my preferred lip filler is Juvederm. What I would be using would be Juvederm Ultra 2. Right, more questions coming in. Can you do anything for dark spots? Yes, we can do something for dark spots. I think that would sort of not be the remit of the webinar today, but yes, we can do something for dark spots. There's different treatments for dark spots, but that's a whole different presentation. So if you come to the clinic, we will advise you on those. Yes, you can combine. So, can I combine Thermage with other treatments? Yes, you can. You just have to be. You have to do it in stages. So if you want to do Botox, you can do Thermage after. You can also do Thermage after Botox. That's no problem. If you do fillers, I would recommend that you do obviously the Thermage before you do the fillers, but then hopefully if you do the Thermage, you won't require fillers if you get really good results. If you had fillers, I would wait for at least 3 to 6 months, better 6 months before you have the Thermage, because although it's not kind of clinically proven, but it is possible that obviously the heat will destroy the filler. So that's kind of the only thing which interferes. You can have microneedling on top of the Thermage. You can have high frequency ultrasound on top of the Thermage. Some other machines actually have these 3 modalities integrated in one. Yes, so you can combine with other treatments. Right, questions are coming in, that's great. Can you have Thermage if you're pregnant? Yes, you can, over the facial area, no problem. I always think if you're pregnant, why not wait? But in principle, you can. Sometimes, I mean, after pregnancy, the skin changes as well. And sometimes after pregnancy, the skin can become a little bit tighter as well. So it's not that pregnancy as such has a negative impact on your skin. How often do you need to do it? You just need to do it once, and then you can do it whenever you want to do it again. So obviously the new collagen, which we built up with the Thermage, has a shelf life in a way, like natural collagen has. Well, we built up a kind of natural collagen. But if you have very good results, I would not do it before a year or 2. The earliest you could do it is after 3 months, which doesn't really make sense. So I would wait for a minimum of 6 months to see the results. Yeah, but you can do it. There is no limit in terms of how often you can do it. Is it good for the stomach? No, it's good for the skin on the stomach, yes. Sorry, a little joke there. Yeah, it's good for tightening the stomach area, yes. Can I do a Thermage on my belly and thigh? Yes, 100%, definitely, and with very good results. Right, any more for any more? Hang on, I think I've got. Right, so thank you very much for attending today. I hope you found, oh, one more. So this is the last one I answer now. I did cool sculpting before and my skin around my belly is loose. Thermage can solve this. Yes, I mean, if you do cool sculpting, the skin will become loose because you are destroying the underlying fat cells, but you are not kind of addressing the skin texture with the cool sculpting. So yes, that would be definitely an indication for Thermage to tighten up that skin. Yeah, but these, yeah, I mean, for these more serious, I mean, it depends how loose the skin is. You might obviously need more than one treatment for that. Okay, one more. Where can I book a session? Yes, you just give our clinic manager a call. It's Sarah, she's on the call as well, or look at the website www.rejuvlab.com. Where? Okay, so it's basically in London, mainly on Harley Street. Right, okay, thank you very much all for attending today. I hope you found it useful. You can still kind of post any questions you have here in this chat function. We will collect them and then we will come back to you individually. I hope you find it useful. I hope you will try Thermage, see how it works for you. Like I said, I can only recommend it as a very kind of natural way of improving your look, having a more youthful plumber look, and also kind of maintaining your look over the years. So thank you very much. My name is Dr. Klaus Bruecker again, and the presentation came from Rejuv Lab London.